This is a case scenario of a passport to practice for a Year 1 Bachelor of Nursing. It is involving a 37-year-old female with the check of vital signs, blood glucose monitoring and oral medications.
Katrina? Hi. Hi, I'm Stacey. I'm going to be working with you today. So, we've got four people that are in the room here, and one of them is going to be your patient for today. I've got the scenario is along with the relevant paperwork. So you've got some time just to have a wee look through, and you can have a sit down before we get started. What I need from you first off is your declaration, lovely, and also you've got your passport to practice on, your peer assessment. Brilliant. So I'll pass you with this, and there's just a chair there, so you just take a few minutes, have a wee look through, and then we can come together and you can let me know your plan for the day.
You will have been called into the clinical suite by your assessor/tutor. That person is also the RN that is on duty with you to take care of your patient. You need to hand in your completed declaration to that person, and your peer assessment would have been uploaded to Blackboard prior to this being sat, as per Blackboard announcement. The scenario here is a 37-year-old female with type 2 diabetes mellitus who is needing a set of vital signs, a blood glucose check and oral medications.
I think I know what I'm going to do.
Wonderful.
Yep. So I'm going to wash my hand first. I'm then going to go and introduce myself to Ms. Porter. And then I'm going to explain to her that I need to do her vital signs and explain what that means. I know she's a diabetic, so I'm going to do her blood sugar as well. And she's got oral medications charted, so great. I will then do some medications for her.
Wonderful. Sounds good.
Cool.
Lovely.
So what Katrina has illustrated is that she said that her plan is going to be to wash her hands, introduce herself to her client, explain the need to do the vital signs and what that entails, and obtain consent. She wanted to do the blood glucose as well as part of her observations, and then she noted that there was oral meds that were charted and needed to be given. A follow-up potentially for this scenario would be have been asked why she had chosen to do it in this particular order. For example, doing the blood glucose prior to the oral meds. So that's a very valid thing to keep in mind as well. Remember, with your hand hygiene, you're aiming between 40 and 60 seconds, so singing happy birthdays to yourself twice in your head is a good indication. Take this time to help gather your thoughts with everything that's going on as well for your assessment, but this is a perfect opportunity to get this particular skill out of the way, assessed, and then you can move on. Remember, throughout your whole interaction with the patient, you need to be mindful of your 5 moments of hand hygiene and utilising either the sink or the alcohol rubs that are available.
Hi, Ms. Porter. Hi, my name's Katrina. I'm a student here at SIT and looking after you today. And I have got a tutor with me who will overtake all of my work. I'm wondering today if I can take your vital signs, which includes your blood pressure, your heart rate, your respiration rates, temperature, and your oxygen saturations. I also see you're a diabetic, so I'd like to take your blood sugars, and I see you've got some medications charted for your diabetes, which I will get onto the blood sugars. Any questions at the moment?
No, all good.
Are you comfortable?
I might go up a fraction if I could.
Yeah. So I'll get mine offside to help you with that.
Great.
Now, do you want the curtains closed for privacy before I go?
No, it's fine like this.
Okay.
That's fine.
So I'll just get mine offside to help you.
Katrina so far has introduced herself and her role as a student nurse along with her tutor. She's explained the procedure of the vital signs, blood glucose monitoring and the oral medications. She has established a rapport, and she has asked if there's any questions and offered privacy. At this stage, you could potentially be asking too of confirming identity. Katrina does do that at a later stage before she actually does any interactions with this person, but this would be another opportunity where you could confirm identity and also preference of name.
for oxygen situations. We have got a sphygmo, we've got a stethoscope, we have also got all of our requirements for blood glucose, including saline so I can clean fingers. And the one thing missing is gloves, and I need medium.
Katrina needs to gather her equipment for her vital signs observations. With this, she needs access to a thermometer, a sphig, a stethoscope, and an O2 sats monitor. She has also decided to get her blood glucose monitoring equipment ready at the same time and have that on her trolley. With this, she needs to include a kidney dish, blood glucose monitor itself, a lancet, a test strip, some normal saline to clean the finger prior to doing the finger prick test, some gauze that can clean following this but also after the finger prick as well, and also some gloves that are the appropriate size for her. She also will need a band-aid, and she may opt to have ready access to alcohol gel that may be beside the bed, or she can put that on her trolley in addition as well. It may be useful also to have a bin set up so she can dispose of her gloves, etc. Otherwise, she is able to dispose if there's ready access near the patient, or when she returns with her trolley, get rid of it in the appropriate receptacles.
Gloves. Not to mention we have the chart, and there is already hand gel in the bedroom. Do you prefer to be called Miss Porter or Stacey?
Oh, Stacey's fine.
Right, so I've got all the equipment we need. And then wrote down photos, so I'll make sure we can't take them. Now, before we start, can I just double check your identity, please? Sure. So, can I have your name? Okay.
Stacey Porter, first and second 82. I don't know what my NHI is.
So we've got ABC 123. ABC 123.
I should know that.
Now, just confirming again, your drug test is no allergies?
No.
So you don't have any allergies? Have you eaten today?
Yes.
Yeah. Was it a big amount of food or small?
Just the usual amount that I have, yeah.
Right. Now, have you had full vital signs taken before?
Yes, I have, yeah.
Oh, I think your bed's a little low for me. I might just bring it up a little bit.
Sure.
Right, it's going to be a bit jerky. I promise I'll lower it before I leave the room. Alright, so you've got a pillow here. I might just borrow that in my name. Right, so I've got a pillow just to make your arm comfortable while I do your blood pressure. So what I'm going to do is, do you know what your normal blood pressure is?
Not really, no.
So I'm going to do a technique called obliteration pulse. And what that means is I'm going to feel for your radial pulse. I'm going to inflate this cuff up, and when your pulse, I can't feel it anymore, it'll give me a starting reading. Then I'll let your arm rest, and then I'll do your proper blood pressure. So what I'm just going to do is fold this up, rest it on your arm. You comfortable?
Yeah.
Okay. So it's going to feel radial pulse.
Oh, that's the wrist one, is it?
It is the wrist one, normally right on the spine. And then we're also going to feel for the brachial, which is the one right in your elbow. Lovely and strong pulse today. So I'm just going to line these arrows up with your oropharyngeal artery. And so this is your left arm. I'm glad I remember my left and right. Right, I'm just going to lift your much up a little bit. You're still warm enough?
Yeah, no, it's toasty.
Yeah, not too firm, not too tight.
No, that's good.
I'm just going to put this on here. That way, I don't lose it. Okay. So, this is going to get a little tight, but it won't be for a long period of time. 100. So when I do your blood pressure, I'm going to pump it up to 120. I'm just going to let that rest for a moment. Still comfortable. Now this little device here measures the oxygen in your blood. So I'm going to put it on your fingers. You don't have any nail polish on? No. No fake nails? Brilliant. And your hands are nice and warm. Apparently cold fingers actually make it play out. Well, that's on. Now, curious things happening on now. That's a good temperature. Now, this goes in your ear. Technical difficulties. Okay. So, what I'm going to do is I'm just going to pull your ear back slightly and start listening to your ear canal. And you'll hear a wee thing. Just checking you have no hearing aids? No. Your temperature is 36.8. So that's within your normal ranges. Normal range is 36 to 37.5. Let's write that down. And we've got oxygen of 97. And we've got a heart rate of 69. Now, that's really nice, but I prefer to do it manually so I can feel what your heartbeat's going. Okay. So, for the heartbeat, I'm going to look at my clock and I'm going to count for 60 seconds. So what I've actually done is I've done your wrist rate as well. So your wrist rate was 12 and your heart rate was 70, both within normal ranges. Wrist rates are between 12 and 20 and your heart rate is between 60 and 100.
Is the rest rate like breathing?
The rest rate's breathing, and the reason I don't tend to tell people when I'm doing the rest rates is we subconsciously change our breathing.
Yes.
So it makes it hard to do with your breathing. Okay. So now I'm going to do your blood pressure. So we're going to go up to 120, and then I'm going to lower it down here. The first sound and the last sound. So this here's going to go on the radial artery, and I've warmed it up already so it's not cold, hopefully. So. This will get a little tight. Just hit it go up a little bit higher because I could hear a beat here. So for 120 to 70, so it's within our normal ranges. Our normal ranges are 120 over 80. However, the high range is 140 over 90, and the low end of that is 90 over 60.
That's much better. I've had it done and it gets pumped up really tight with the machines.
So we got the obliteration pulse because we don't go too high. You've got that documented. So, done temperature, we've done your heart rate, respiratory and blood pressure, and we've done your oxygen saturation. That leaves blood sugars.
Katrina did all the vital sign observations here, the temperature, the pulse rate, the respiratory rate, the SpO2 saturations and the blood pressure. She was able to establish the normal ranges and advise the patient of this and in turn the assessor. But if she had not said this, this would be a follow-up question and we would be asking you what are the normal ranges and is the observation that you've just taken within or out of the normal ranges, and also the specific qualities of the different ones as well. What we're looking for with the temperature, so in this case Stacey came back as 36.8, which was within the normal range of 36 to 37.5. She performed the procedure correctly. She inserted the probe snugly into the external ear. She used gentle pressure and angled the thermometer towards the person's jawline and was able to obtain a correct reading. She also documented this in the observation chart. So the next one was the radial pulse rate. So for this, Katrina placed her first 2 to 3 fingers over the radial artery. She lightly compressed the artery so that the pulsations could be felt, and she was able to determine the strength of the pulse. She said it was strong, and she checked the rhythm. She said that it was regular. So this would be a follow-up question that you would be asked as well, and she took it for the 30 seconds and she multiplied it by 2 because it was regular. If it had been irregular, or she suspected it was, then she would have taken it for the full minute to establish that. The reading came back as heart rate of 70, and she established that the normal range was in 60 to 100 beats per minute, so within the normal range. Katrina established that Stacey's resp rate was 12, with the normal range being between 12 and 20. In order to assess this correctly, the rate is accurately determined only after the RN has viewed a respiratory cycle, meaning 1 respiratory cycle is equal to 1 inspiration and 1 expiration. Katrina was able to do the blood pressure, where she firstly did the obliteration pulse, then she did her other observations prior to doing the full-blown blood pressure to give that arm some time. She established that the blood pressure was 125/80, and she was able to establish that was in the normal range, with the lower range being 90/60 and upper range 140/90. The other thing she was able to determine was that she could feel that there was a pulse when she was pumping up the agreed 20 millimeters of mercury above the obliteration pulse. Therefore, she pumped it a fraction higher. If you felt that you had not gained this accurately, what would be appropriate would be to redo the blood pressure. So that might be give the arm some time or try it on another arm, but making sure you're giving that arm a little bit of time in between. So you may choose to do some of your other observations and then come back to it if you're unsure. The tutor may also use a double-ended stethoscope to check that how you're going with your blood pressure. So this may be occurring during your assessment. The key aspects to be aware of when it comes to measuring the blood pressure is that you need to, at the start of your interaction, apply the blood pressure cuff accurately in the right way and in relation to the brachial artery. So it's useful to palpate the brachial artery and position the cuff appropriately in relation to that. The other thing is when you're doing your actual blood pressure itself, you want to be hearing for the first clear sound. So that's going to be your systolic pressure, and then it'll slowly increase in intensity. The next thing you need to be mindful of is when you are reducing it, you need to continue to steadily deflate the cuff and note when the sound alters and becomes muffled. This is the diastolic reading. You need to listen for another 10 to 20 millimeters of mercury after the last sound, as there may be some additional sounds that occur, and then allow the remaining air to escape fairly quickly, but controlled.
Stethoscope towards the eyes. Brachial. Your blood pressure's one.
So, for the measuring of the blood glucose level, Katrina needs to be mindful of checking the medical order for the monitoring schedule. So at the top left, it has the frequency of blood sugar testing, and that is down as daily, and Stacey had not had this done previously, so that is correct. The other thing she needs to be mindful of is her hand hygiene, washing her hands and donning disposable gloves. So she needs to make sure that when she is using disposable gloves, that she is doing hand hygiene before and after removal, in addition to the usual 5 moments. The other thing is her documentation, so that's on the screen chart here. She's put the date and the time and the blood glucose level of 4.3. I acknowledge this is different than the previous video footage. That is because it's been taken at a different stage. So for the purposes of the ongoing assessment, it will be down as 4.3. And then she's got the initials of herself and of her RN that is working with her / her assessor. And that's all that she needs to document down. No insulin, everything else is all good.
Hi Katrina, how are you getting on with things?
Going well. So we've done full set of obs. Everything's within normal ranges. We've done blood sugars, 4.3. No insulin. However, in the chart here, Stacey has got medication started. She's got metformin here, which I'll double check, but I believe is her diabetic tablet. Stacey also said she had pain of 4 out of 10. Her back, previous injury, and it's irritated by lying in bed. So I would like some paracetamol. So I'll just have a look at the minutes. So I've had a look here. We've got the medication, the dose, the route, frequency, and I've had a look over on the side column, and there's nothing been given. So I'm able to give within the time frames that I charted. So I've got Stacey Porter's chart, and I'll double check her ID when we go back to her room.
So yep, you've identified the 5 rights there?
Yep. So we've done the 5 rights. I'm just going to double check on the medication. Oh, and I've just before you came in, I used hand gel on my hands as well. Metformin. So metformin is for the treatment of type 2 diabetes. There can be contraindication is to be careful giving this for someone who's got renal failure or severe hepatic insufficiency. So precautions are renal and mild to moderate hepatic impairment. If they've got lactic acidosis, so the adverse effects are very common as a GI upset, so that's the nausea, vomiting, possibly diarrhea. They might develop a metallic taste in their mouth, and it can also reduce vitamin B12. So the dose that should be taken with food. Stacey's just had breakfast, had it about 2 hours ago, so we're due to have morning tea, so we're in good time to give with food. And the dose here is 500 milligrams, but it can be given 2 to 3 times a day. The doctor's actually charted 850 milligrams.
And she just has that once a day?
Just once a day. So I had read in her notes that the doctor wanted the higher dose to hold her through. So it's still within the dosage required. So it's the metformin.
And so she said that she's due for that, so what was her reading? Do you feel comfortable with the reading that you've got in relation to the medication?
Her blood sugar was above normal, 1.3, which is safe to give medication. And the fact that she's about to have food helps, and also this medication is not going to take effect straight away. So by the time her blood sugar climbs with the food, it's going to have time to then start working.
Right.
So I'm confident giving that. And the other medication to give is paracetamol. There's so many paracetamols in here. No wonder Stacey was a little confused when I was talking about a completely different medication to her. So paracetamol is an analgesic, and it's an antipyretic, so that means it helps reduce fever. It can be given oral or rectally, and there can also be IV administration. So the doctor has charted this as an oral PRN up to 4 times a day. She's also only allowed 500 milligrams, which is half a dose most adults would have. So there must be some kind of renal or hepatic issues going on there. Can be used for backache. So adverse effects are common as GI upset, again with the nausea, vomiting, diarrhea. Can elevate liver function tests. If there was an injection site, there could be a reaction at the site, but that's not relevant to us. And in some cases it can cause fatigue, chest pain and fever. So the dose for an adult is, so they should have 500 milligrams to 1,000 milligrams in a dose, and they have allowed 4 doses in 24 hours. So that is 4,000 milligrams in a 24-hour period. However, Stacey's only allowed 500 milligrams per dose, so that is 2,000 milligrams that Stacey's allowed in a 24-hour period.
And what would that be in grams?
In grams, it would be 2 grams.
Great.
Okay, so basic paracetamol. So I've got water in my medication file. Right, first medication I'm going to look for is metformin. So metformin 850 milligrams. It is a tablet, so it's for oral. Once a day hasn't been given. It's been signed correctly by the doctor. Expiry date November 2021. It's metformin 850 milligrams. So that's a 1 tablet there. 1 tablet. So we've got metformin. So again, checking metformin 850 milligrams. Metformin 850 milligrams. Tablet, and it hasn't been given. So metformin back. So the other one on the list is paracetamol. So we've got paracetamol 500 milligrams, expires 30th of 7th 2023. Paracetamol, the dose is 500 milligrams. That would be 1 tablet. Oral, so it's a correct form. PRN QID, so it's PRN 4 times a day, and it has not been given yet. So you happy with? Yep. So it's one of these. Just double checking. Paracetamol 500 milligram. Paracetamol 500 milligram per oral. Has not been given, so we are able to give it. Great. So, I've checked my fibroids, I've checked the medications in the limbs, so do you understand I know what the medications are for? Yes. I've double and triple checked what medication I've got is what I've actually taken. So I think I'm ready to go and see a patient now. Great. Sounds good.
Katrina is needing to ensure that she does the 3 checks. So that's checking each medication order against the original prescriber in order according to the facility and policy. That's to establish any inconsistencies. So she did this when she first opened them. She had a look, she confirmed the drug, the expiry date, if it was the right order. She popped it into the container, and then after this, she checked it again against the order. And then prior to going to the patient, she's going to check that one more time. So checking the medication order against the prescriber, and that's your 3 checks. The other thing that she needs to ensure is that checking the 5 rights. So checking that it's the right person, the right health consumer's name, the right medication, the right dose, the right route, and the right time for administration. So Katrina in this case confirmed that it was for Stacey Porter, that the 2 medications were the correct ones of metformin and of paracetamol. She confirmed that they were each the correct dose. So with the metformin, it was at 850 milligrams once a day. With the paracetamol, it was the lower dose of 500 milligrams. She confirmed that they were both the right route of administration, being both oral. And she confirmed that it was the right time for administration, as neither of them had previously been given, so they were right to be given at that point. Another important thing to note is allergies. So that needs to be established with your checking of the medication sheet itself. You need to see if there's any allergies in addition to asking the person themselves. So you could do that prior, but also again, when you're going to administer any medication at all, you would be asking for any known allergies. The other thing is important as well is obviously your documentation. So once you've confirmed your person, once you've administered the actual medication at the bedside, then you can document it. And keeping in mind that as a student nurse, you will need to be getting this signed off. So the person that is with you is, yes, your assessor, but they are also the RN that is on duty with you. So you would get them to double sign that.
Hi, Stacey. Hi. Alright, so I've got some medications for you. So how are you feeling?
Yeah, good. Not too bad.
Still feeling comfortable?
Yeah, I'm alright.
Right. I know this is a bit tedious, but we need to check your identity again. I know I've just been here. So we can just double check again. Stacey Porter.
First or second lady too.
Perfect. And it's ABC 1, 2, 3. Lovely. And confirming again, no allergies.
No, not that I know
So we've got the metformin here, which is for your diabetes. Now, I see morning tea is coming down the hallway right now.
Nice.
So we'll be able to get that to you. Right, my pen is playing up. So we've also got here paracetamol, which is a 500 milligram tablet.
Yep.
Okay. You haven't had this before either.
No, not today.
I'll take that empty bottle. Right, so I'm just going to sign for those. My tube's going to countersign it and make sure it's all correct. Now, is there anything else I can do for you at the moment?
No, I'm fine.
So what I'm going to do is I'm going to leave you the rest. You've got your call bell with you. My buddy nurse is going to sign this as well. I will. Right, so I'm going to get my buddy nurse to sign off the medications since she's observed them being given. I'm going to come back in 20 minutes, then half an hour to see if the pain relief has actually helped you. If it hasn't eased the discomfort in your back, then I might need to get the doctor to look at charting something more for you. If you need me in the meantime, please call back. I'll take the rubbish away.
Oh, good, it looks like skulls.
Smells divine. Right, give me a call if you need me. Everything. Yeah.
So remember before you leave, as Katrina illustrated, that she established that the bed height has been lowered from following when she did her vital signs and her other investigations. The brake is on the bed, so it isn't going to move. The bell is within reach for the health consumer, so if she needs to contact her prior, that is perfectly fine. It's within reach and it's functional. She's also said that she'll be back soon, and also established following her pain relief that she'd given her an estimated time of when she'd be back to check on her, but that she was to make contact with her if she needed her in the meantime, and then said her farewells. Before you leave, remember the 5 Bs.